On this episode, we're going to talk about the ROI you should be getting on your advertising, what happens when the SEO isn't working, and a dental practice that's giving away a free car. Hey everybody, and welcome to the 88 Dental Marketing Show. I am your host, Joshua Scott, and this is the internet's only show that's answering dentistry's most important marketing questions. Don't forget it, believe the hype. We got a good show today. Got three really great questions. We're gonna be talking about what type of ROI you should be expecting on your advertising efforts. What to do when the SEO is not working. You've hired a company and it's not working out. And last, a actual dental practice who's giving away a car. So we're going to talk about those things. I think it's going to be a good show. Let's get to the questions.
Our first question is from Alex Wright. What return on investment should you shoot for when advertising?
Alex, ROI on your investment. Great question. Before we can get to the ROI, we need to throw a number out there, which is the average cost of a new patient. And so we typically put the acquisition cost at around $250 for the average patient in your practice. And you just got to keep in mind, that's all the internal referrals and all the external marketing. You put them together, you average it out, it's about $250. You're going to spend less for internal referrals and you're going to spend more than that for external. Okay, so that's the only caveat there. Now, the other number we need to know is the average patient that you bought for $250 produces about $1,000 in a 1 year, maybe 18-month period. So that's the return on investment. So the canned answer you're going to hear from a lot of marketing experts out there, and just generally, is you want to see a 3-to-1 return on your marketing. That's what we throw out all the time as a benchmark. The truth is, and the kind of softer answer is you can go all the way up to that $1,000. Honestly, if a patient costs you $1,000, but they produce $1,000 in that year, then in a sense you're at a wash. Okay, except for the fact that you now have a patient in your practice, which has continuing value, and hopefully you have access to their network of friends and family, and there's some referrals. So, it could go all the way up to $1,000. It's not the best use of your money, but in a sense, it could go there. Now, some examples, when we're talking about internal referrals, for every unit you invest there, you should see that tenfold at least. A good patient referral program should be like more a 10-to-1 type return. Okay, so that by far is the best. Outside of that, I think if we look into like Google Plus and Yelp and Facebook, those guys, kind of that digital space, man, I'm seeing that more like 8-to-1 return. Getting Google reviews and some Facebook advertising and being the #1 listing on Yelp, literally for whatever you invest there, I'm seeing about an 8-to-1, 7-to-1, 9-to-1 type return. And so that's a really good space. Google AdWords, if you're in that space, I'm seeing more like a 4 or 5-to-1. And how I judge that is a lot of Google AdWords campaigns, you're in it for $1,000 a month. That's a pretty standard investment with Google AdWords. And so if you're seeing that, you're probably getting 4, 5, maybe 6 new patients a month from that. So that's still, we're seeing a really good return there. Now we get into some things like Yellow Pages, right? Most practices I run across, when we run the numbers, I'm seeing them spend upwards of $500 for patients on Yellow Pages. And so that's a 2-to-1 return. If you spend $500 and they give you $1,000, that's 2-to-1. And last, is probably direct mail. Usually it's going to be above $500, but a lot of times I'm seeing it closer to the $1,000 mark. And so that literally is a 1-to-1 type return where it's a wash, except you're getting new patients in the practice. And there are times when that can be critical to just during a season, you need 20, 30, 40 new patients and have access to friends and family and hopefully get some referrals and just build the practice. So there are times when that's beneficial, but clearly there are some investments that are a lot better. And good job for you. ROI is something you should always have a handle on.
Question number 2 comes from Dr. Dan Robinson. I currently have an SEO company, but I'm not happy with my Google local listing. They claim it takes time. Should I continue my services with them? And how can I improve my ranking on Google+?
Dr. Robinson, good question. Yeah, this is like the frustrating part of SEO work sometimes, is that it's not going the way you want, and the SEO company is like, hey, we just need more time, just give us more time. And I know we find ourselves in the same position sometimes. It's like, we're like the middleman. I mean, you've got Google on one side that you're trying to like get these results from, and you've got the client's expectations on the other side. And so it can be tricky for sure. We didn't put this in the question, but I know the company that you're working with, and it's a reputable company. So there's that. You mentioned you've been with them 6 months. So yeah, I mean, 6 months is right on that edge. Like we should be seeing some progress, but it may not be quite what we want or the expectation we have. So yeah, the first thing I would probably start with is talk to them, like ask them what has happened in the last 6 months. Like what's the strategy been? What's been accomplished? And I would tend to judge the strategy more than I would the outcome. Which I know the outcome is hugely important. I mean, that's why you hire them. You're spending a lot of money to get to a certain outcome. But if you just focus on that outcome, you could miss something that's more challenging with your listing, or something that's complicating things there that, again, just need more time. So I would start there. But, then you ask, like, what can you do? So one thing, whenever I see a Google Plus listing that's not ranking well, I immediately go to all the local listing information across the web. And what you want to make sure is it's all consistent. The exact same phone numbers, the title of your business, whether it's your name or whether there's a branded name, all those listings need to have that exact same name with the exact same wording. Phone numbers the same, all that. Because what happens is Google may be hesitant to put you in the top, because they don't have confidence that the address is the right one, because they see 2 other addresses out there. Or they don't have confidence that that phone number is right because there's other ones there. And so that's how that game gets played. A really great resource where I would go is Moz.com. Moz.com. And they have a product on there called Moz Local. You can plug in your practice information and they'll give you a score. And they'll tell you, like, you have this many duplicate listings, this many incomplete listings, this many inconsistent. And so it helps you just get a snapshot of the overall, the listing kind of graphic of the practice and how that rates. So now, of course, you can hire them to help with that, but it would at least kind of give you some indication of whether there's a problem there or not. Outside of that, I mean, it's the things we know Google loves. They love reviews. So you got to make sure there's a handful of reviews getting posted every month. Then I would post content to your Google Plus page. I mean, whatever you're doing on Facebook and your blog, like bring all that and post it to Google Plus as well. It shows activity. It shows that you care about it. It's important. Man, do those things. If you're doing all that, yeah, then some of it is you just wait. And just give it more time. Maybe bring in another expert, have them just take a look at it and analyze it. I'd probably maybe give it another 6 months, and if nothing's changing, bring in somebody else to just take a look at it and get their expert advice. But those are the things I would do.
And our third question is from Carol Hughes. What do you think about giving away a free car as a new patient promotion?
So, a dental practice giving away a car. And what Carol means is these guys giving away a Jeep as a new patient promotion. It's interesting. Is it attention grabbing? I mean, does it get attention? Yeah. Is it gimmicky? Yeah, completely. But I mean, I'm the first one to say I'm not a hater on gimmicks. I think, if your practice model fits that, if it fits gimmicky, then fine. It's not right or wrong. It's just I don't know anything about these guys. I don't know this practice. I think it's up in the Northwest somewhere. So I don't know if that's a good play for them or not. It's interesting when you look at the rules here in the fine print. So you get an entry for every new patient you refer. So during that 6-month period, you have to be present to win. You have to be 18, have a valid driver's license, proof of insurance, all that. But it's actually not a brand new Jeep. It's a pre-owned 2015 Jeep valued at approximately $15,000 at the time of the giveaway. So what I would imagine, what I see in my mind is these guys probably bought this Jeep. I'm sure it's a base model Jeep. They probably did one of those like advertising wraps on it with their practice logo and their brand and stuff. They've probably been driving it around for a year, and then they're going to give it away. So they're getting all this marketing out of it, and then they're going to give it to somebody. Probably take the wrap off and give it to them, or leave the wrap on. Who knows? It's interesting. How do you? My first thought is like, well, how do you keep building on that? I mean, what do you do next year? How do you top that again? And practices or companies that get into these marketing cycles of like always having to outdo themselves with the next big thing. It's a tough game to continue to play. It's like being in like a rat wheel or something where it's just like it just keeps spinning and spinning and it just never stops. And trying to sustain a practice on big ideas, big promotions like that, I would imagine would just get exhausting. But at the same time, it's they got attention. Look, this is like Miley Cyrus all over again, right? Like the Miley Cyrus of the dental world, okay? Like remember her VMA performance where she came out and just kind of like shocked the world with Robin Thicke and people were like, what just happened? It's everything that we love and we hate about marketing wrapped up in one. Did Miley come out and get short-term attention for that performance and for this new album? Yes, definitely. I mean, they were talking about it for a week or two after. Long term, is that a good play for Miley? I don't know. I mean, is this a good play for her as a brand? Can she sustain that? Like, what her next performance? What does she do to top that? Is this a brand that's going to sell and connect with consumers? I don't know. And so this is like everything we love and hate about marketing in dentistry. Is this a good, in the short term, does this get attention? Yes. Long term, is this a good play for that brand? Is this a good play for dentistry? I think those are the questions, right? And it's yet to be seen. I mean, only time will tell. So, So I think that's all I have to say about that, but really, really interesting. So thanks for bringing that up. Guys, homework for this episode is figure out the ROI on your marketing. Take the top 2 or 3, 4 things you do. What did you spend on those things? And then how many new patients did you get from it? And then you just divide, and it's real easy. So if you got, if you spent $10,000 on Yellow Pages and you got 10 new patients, you spent $1,000 on each of those new patients. So you went 1-to-1. So do that. That's your homework. Figure out the ROI on your advertising. Analyze it. Look at it. What do you think? So, guys, thanks for being a part of episode 13. As always, it's a pleasure. I will see you next time.